Good morning, and thank you for joining us today. Welcome to Regulation Navigation with Warren Miller, brought to you by ITS. This is our first informational webinar of the year, and we plan to continue this series centered around various regulation-related topics that cover operator qualification basics and give an opportunity for you to learn something new or validate what you already know or get answers to a question that you may have. Today, we're going to discuss the newly updated Department of Transportation Pipeline and Hazardous Materials Safety Administration, or PHMSA's Operator Qualification Frequently Asked Questions, or OQFAQ. What a mouthful, right? What has significantly changed from the previous version, and what you can expect regulators may focus on in future inspections. I'm Chris Taylor, the Creative Director at ITS, and I'm here to facilitate this discussion. With me is ITS Regulatory Compliance Specialist Warren Miller and ITS Director of Compliance Lenny Kimball. Warren is a former federal regulator, and Lenny is a former OQ compliance manager for a major natural gas transmission and distribution operator. To our audience, thank you all for joining us today. Before we get started, just a bit of housekeeping to ensure this experience is beneficial for all of you. This session will be recorded. And during the presentation, if you have any questions, please submit those in the chat box. We will, actually it's the question and answer box, but the chat box will work as well. We will have time at the end of the discussion for Warren and Lenny to answer your questions. And if we're unable to answer your question during the session, we'll be sure to follow up afterwards. And just a general reminder, the information and views expressed in this webinar series should not be utilized as your only source of information. So without further ado, let's get started. All right. So just over 1 year ago, PHMSA announced its intention to update the FAQs, and at that time issued a proposed version of what is now online and just published last month. And at that time, they stated their intention for this revision would be to replace some questions and answers that were outdated or no longer relevant, and while also ensuring that each FAQ is tied to a specific regulatory requirement. The newly published FAQ is now available online at the link shown on screen and posted here in chat. The FAQ was previously last updated back in 2017. Warren and the team have analyzed these new updates, comparing the topics and the language to the previous version. And while we will discuss here some of the changes that we view as significant, we recommend you do the same, and we are providing you a tool to do so. After the webinar, we'll send out a link to a downloadable spreadsheet listing all the former and the current items. The questions and answers on the FAQ are ordered by topics, as you see on screen here. The subjects range from addressing the use of off-the-shelf programs, such as our own ITS Enhanced OQ program, used by operators large and small throughout the country, to other topics such as contractor qualifications, training requirements, written plan and process or program considerations, and much more. Warren, how long has PHMSA been using FAQs, and what is its purpose?
Chris, I'm actually not sure when PHMSA started using them. I know that originally these FAQs for OQ were derived after the PHMSA team had done fact gathering reviews of 16 operators and their programs, and initially put out in January 2003. And then after there was the fourth public meeting and the initial inspections, there was some supplementary guidance put out in June 2003. One of the things that's up on the screen right now is actually the PHMSA guidance webpage. And I do want to point out the very first paragraph, what it states about the guidance. It says it is intended to help regulated entities and the public to understand the regulations. The guidance documents contained in herein lack the force and effect of law unless expressly authorized by statute or incorporated in a contract. It says DOT may not cite, use, or rely on any guidance that is not available through this guidance portal except to establish historical facts. So there is this information that actually sits out there on the web. It has the PHMSA FAQs. It's also got the advisory bulletins that also has OQ information and the enforcement guidance, which is quite a document that's available. So you can use this link to do some quick referencing to help you review your program as you go. You know, the FAQs were originally just trying to give guidance. The regulation was built in such a performance-based language. You know, we've just got 9 short paragraphs trying to provide guidance on how somebody would build and you know, develop a process for getting personnel qualified. One of the things I will remind folks that are in the industry is that I know that FAQs have been utilized as some guidance for integrity management. So there is one of those areas that FAQs have been utilized. Again, kind of a gray area, but these FAQs, you know, they can give people an idea of how PHMSA is interpreting law and what they may be focusing on, warning. You know, certainly if there's accident were to occur, you know, these FAQs could be driven further. Again, just depends on, you know, what happens next.
Thank you. So in other words, if, you know, they state that they are not using the language in the FAQ as the basis to cite operators, but they are, you know, referencing on each one the actual law that they could use to cite operators. Is that correct? They talk about the portion that's in the code and, you know, address, you know, certain things that people may not understand, you know, by 801 or 803. I mean, 192, 801 or 803. Thank you. I'd like to take a second before we jump into highlighting the specific areas of, again, what we view as significant change or new additions. But what about items that are no longer mentioned in the FAQ? In the previous version, there were 62 questions and answers posted. Now there are 40. In some cases, they may have been grouped within another question and answer, but in some they appear to be completely removed. How should operators interpret that?
I'd ask your inspector. You know, we can't assume to know what PHMSA intended in these new FAQ documents because it really doesn't state what no corresponding FAQ means. Are they letting that go? Or again, as you stated, some of them are newly addressed in a different format, but some of these, and some of them are no longer, you know, like work performance history. You know, that's been such a long time ago. It never was allowed as a sole method, except for before OQ. And, you know, it's kind of fallen away, but some of these, you know, could be active, could be not, but not sure how, you know, PHMSA in the states are going to look at it.
Okay. Warren, can you talk about the approach that you and the team took for this analysis? As we mentioned earlier, we'll be providing our viewers a downloadable tool that can aid in their own analysis. And that's where you and the team started as well. What was the next step?
Well, certainly we looked at, you know, the old questions from 17 and then the new ones that they put out, and kind of just broke them down. First off, took the no corresponding FAQs and lumped them together. And so that's really about 40% of the questions were actually taken, are no longer, they're grayed out. Again, it's a gray area, so not sure exactly what to do with those. And then we looked at it, the question and answer on the with regard to its purpose, whether it was just a program level, whether it was about the written plan or training, and focused on those 3 areas. And then kind of reviewed the next step for importance. And again, I really want to make sure everybody understands this was importance through my team's eyes. It may not be important in your eyes. If you got a very high level program and you've got all these things addressed, some of these things that are officially now in writing may not affect you at all, whereas something else you may never have thought of and you've really got to take issue with. So again, that's why we're going to offer up that tool for you guys to utilize this and go through your own process to, see where you're affected the most.
Thank you. So taking the tool, you went through, read line by line and classified, ranking them medium, high, medium, and low, and then also kind of what area it affected, and got the breakdown here. And as you stated, we focused on 3 areas. We're going to start out highlighting some 20 or so items, maybe a little more than that today. And we're going to keep it really high level, try to keep it brief, but point out the things that really stood out to us. And we're going to start with the written plans area. So Lenny, I think we're going to start with number 31 on the new FAQ. How should an operator address a situation in which an individual who is qualified to perform a covered task is performing that covered task incorrectly?
The employee should be immediately removed from performing that covered task, which many of the operators now will suspend that individual from that task right then, pending a deficiency review. There should be written policies for dealing with deficiencies in performance, which should be developed by the operator. Now, the actions that come from the review could be anything from retraining, reevaluation, and that includes that they have the knowledge and the skill and the ability, to be able to perform that covered task. It could lead to disqualification for that individual never doing that task again, or a change in the training process of that task, which could be a big deal for the operator, where it could require all employees to be retrained in that covered task and everything along those lines, Chris.
Thank you. We're going to move to number 30. Should operators incorporate criteria in their OQ programs regarding the suspension or disqualification of an individual who performs a covered tasks?
You bet. And I see they've kind of broke this down in a couple of ways, but an operator's OQ program should have a section in there that covers evaluation for cause. So if you have an incident, and this is on the OQ piece of it, it'll be separate from your incident investigation, but you need to be looking at what caused that as far as the covered task piece of that, or it could be several covered tasks. But what happens if that incident occurs, what you do? This will follow closely with what we just discussed a minute ago. This, again, it could cover more than one covered task. Also, an operator should monitor qualified employees' mental and physical abilities to continually perform covered tasks. Is the employee performing the covered tasks often enough to have the knowledge and the skill to continue performing the covered task? And that should be part of the process. But what happens if it is determined the individual is no longer qualified? Chris, the operator should have a process in the OQ program to make all of these determinations and the actions and the way to record all of this information.
Thank you. We're going to move to number 38. What types of changes should be communicated to individuals performing covered tasks?
Chris, management of change has always been a hot topic. Certainly, different operators have different levels of communication programs. One of the things that they addressed in this is they actually put down reasons for communicating, which a lot of operators, just had a blanket statement. Certainly modification to company policies or procedures, changes to the regulations, whether it's state or federal, utilizing new equipment or technology, and technology especially as much as it's changing. And then new information you might get from equipment or product manufacturers. The big thing is, how is that information, how is that information going to be communicated to your operating personnel, your contractors, anybody that's actually doing the work? And then if there's enough change that affects the covered task, then requiring, at what point is it, what's the impact of change? Is it a high impact, low, medium? And again, this would be something that operator would want in their program to address how they're going to do it. The other part of this is that also addressed is significant, and the significant has actually been defined in the PHMSA operator qualification glossary that was going to be tied into this chat, but they have defined it. Again, this was one of the questions I was asked forever and ever, is define significant. And this language comes out of the old NPRM that was not brought into law, but talks about increasing the evaluation intervals and span of control ratios, eliminating covered tasks, changing mergers or acquisitions, or if you have evaluation methods, let's say you're doing written and performance and you decide to go to written, and then the overall plan. If you change your plan out wholesale, those are kind of things that PHMSA and the states will be looking for notification on. Not necessarily that you'll get an inspection on it, but this, it's that requirement of notification, so they can call and maybe ask you a question why you eliminated 30 tasks. We had one operator that did that and found out that they'd gotten rid of all of their gas. They went back to strictly liquid. It made sense, so nothing was ever changed from that.
Thank you. We're going to move to number 14. What are acceptable evaluation methods, and what is observation of an individual?
Well, the code pretty well spells out the different, we got written exam, oral exam, work performance history, again, not as a sole method. Observation of on the job, or performance on the job, again, not as a sole method. On the job training, simulations, or other forms of assessment. And again, I think other forms of assessment is going to play into some of the new technology that's coming. But you'll want to step lightly into any new forms to make sure that your regulators buy off on these new types of assessment. The big thing is evaluation method must include adequate interaction between the observer and the observed to determine that the individual is qualified. May have to, while observing the performance task, requesting the individual to talk about abnormal operating conditions associated with it and how they may take action. And then observation of an individual, again, if that's being used as an evaluation method, the evaluator would not just observe that person perform that task. Yes, it shows his skill and ability, but it doesn't show anything about his knowledge, doesn't talk about the AOC. So that's why this was, I believe, specifically called out.
That's good insight. Thank you. Number 10 states or asks, how should an operator differentiate between O&M tasks and new construction tasks? Lenny?
This has been a hot topic for a really long time. Warren could talk about this forever as well, but I know as an operator, it was one thing that you really had to define as a company because it affects you, it affects your contractors. It really is a big deal in making that determination. As far as O&M on an existing pipeline or replacement with like pipe is not considered new construction. Now, new construction is a new pipeline segment or a segment replacement with a different size pipe. It is considered new construction until that is tied into an existing pipe, okay, on either end. Once you tie that pipe in, it is now covered, okay? So you've got to make sure you're aware of that, and you do have qualified employees there for those tie-ins, and then every piece that you work on after that tie-in. I remember times where we ended up pulling valves back out that were put in too quickly and starting over and making sure we had qualified individuals for all of that. Doesn't happen often, but it does happen. Another thing is capital and operating budgets. do not make the determination what's new construction, okay, and what isn't. It has nothing to do with your budget, the way you appropriate those funds and so on. It has to do with the determination that you make. Now, many of the operators have already done away with new construction because it is such a gray area at times. But they just wanted to make sure they had qualified individuals for all of the pieces. But right now, that's kind of where it sits, Chris.
Thanks. I know a couple of states currently also don't make that distinguishment at the state level as well.
Correct.
We're going to move to number 25. Should an OQ program specify the maximum distance that a qualified individual must be from an unqualified individual who's performing a covered task?
There is no requirement for maximum distance. Again, span of control came out about because of allowing people to be non-qualified to perform if they're directed to observe. So this really varies with each covered task that an operator allows span of control on. So again, some of those tasks, operator may not allow span of control except for maybe training, or there actually can't be done by somebody that's not qualified, such as welding or fusion. Kind of give you an idea, coating a pipe versus testing a regulator. If we're coating a pipe in a ditch, the guy that's directed and observing, he can say, you guys didn't get it right. We're gonna have to cut it off and redo it. And so he could be a little further away than the individual that's testing a regulator, and he's working with, a live system, and that any misstep can cause issues. So this is why it's so important that they're training of your qualified individual, so he understands his or her responsibility in where they have to be if they're directed at observing a non-qualified individual, and to be able to take appropriate actions in case an abnormal operating condition develops, or anything else that needs to be taken care of.
Makes sense. We're going to move to number 26 on the FAQ. What is the maximum number of unqualified individuals performing a covered task that a qualified individual can direct and observe? So another span of control question.
This goes along with questions that have been asked forever. Years ago, there were operators that had no limits. They had 7 to 1, so one person was able to look at 7 people. But the language that's been addressed here is operators should determine the appropriate number of unqualified individuals that can be directed observed by a qualified individual. That may vary depending on the covered task, and that certainly it would. The operator has to consider or should consider relevant conditions such as physical space limitations, environmental conditions. If you can't hear inside a reg station and talking, hand gestures, whatever, if it's raining, muddy, all those conditions may affect and may determine, may cause the qualified individual to say, I'm only going to look at 1-to-1 out here in this situation with the heavy rain and the lightning and everything, or may not even do the task at all. But the operator should also consider the complexity and the consequence of the covered task. I'd recommend you have a process in place to look at those any new covered tasks that you might identify. I will let you know that PHMSA has issued a notice of amendment on span of control where the practical limitations were exceeded. So an operator was saying to work on a rectifier, it was 1 to 3. And the argument was, if you put 3 unqualified people in front of a rectifier box, how is the qualified individual actually going to be able to observe them? And so, this has been addressed in a compliance action.
Also makes sense. So that wraps up our highlights of items around written program issues, but there are other questions and answers related to them. We just didn't find them as significant as the ones we highlighted just a moment ago. We're going to move on to program issues. So things considering the OQ program itself. First question is number 4 that we're going to highlight. Are contractors required to use the operator's procedures when performing covered tasks? Warren?
I wanted to draw everybody's attention to this answer. This FAQ has a must statement in it. The very second question, word says operators must ensure that contractors follow the operator's written procedures, just as operators personnel must. Okay, that kind of sounds more than guidance, folks. I think that it's been talked about, but I know there's certain operators that don't want to even share their procedures with their contractors. But whatever procedures the operator has, he's got to provide to the folks doing the work. Or it's also if there's procedures that are approved that are like say contractor procedures, such as NDT, non-destructive work that these specialists do. A lot of operators don't have even the technical people working for them to say, well, here's everything we're going to do about X-ray. And this is where you would say, I approve these procedures, but you've got to have them in place prior to the folks performing the covered task. And they state here that records of contractor procedures and the operator's approval of those procedures are required to be maintained. So they've got a must and they're saying required. So really pay close attention to this as you review this against your program.
Thank you for that guidance. Number 5, who is responsible for qualifying contractor individuals who perform covered tasks on the operator's pipeline facilities? Lenny?
The operator is responsible. I mean, the operator is responsible for all individuals that touch the pipeline facilities or could affect the operation or integrity of those facilities. And it doesn't matter, again, if it's in-house employees or contractors or other personnel, it's anyone that could touch those facilities. It's also up to the operator to determine whether or not they're going to allow the contractors to self-qualify, or if they're going to require them to go through a third party for qualification. That is determined by the operator as well. The other part of that is the operator must verify, and it kind of goes along with what Warren was saying a minute ago, they must verify and document the contractor's adherence to the operator's OQ requirements. So they need to make sure that those contractors are following along with the OQ requirements of the operator and that they're following that program. And it can be daunting at times, but it does take a lot of detail to make sure that everyone touching those facilities is qualified. And the operators work very hard at this, Chris. It's something they really take note of and work hard on.
It's important. Number 12, we're going to hit next. Do emergency responders need to be qualified under the operator's program? Warren?
This has always been a gray area, and they've pretty well stated it. Again, this answer provides more than guidance the way it's worded. Basically, if you have made plans or had correspondence with emergency personnel, whether it's fire or police, so your liaison work or whatever, and if you've talked to them about performing a covered task that it's in your plan, like shutting valves off or things like this, then you need to bring them under your plan and get them qualified. If they are acting on your behalf, now if they're responding and they come in and shut your valve due to the emergency, that's their job. But if you go to them prior to an emergency and say, if this occurs, this is what we want you to do, that's when it's kind of it's almost like a verbal contract, and you verbalize that they're going to do something for you. And if it is a covered task, then you would have to have them qualified under your OQ program. So there's a lot of operators who don't have the hot suits. You know, they don't want to maintain them and stuff. And so if they're, you know, if they're expecting and made discussion with them prior to, then you're going to have to. Sorry, this is just such a very bold statement, and you know, and has called it to the carpet. So I'm going to bet that the inspectors will be looking to see if your liaison has included this type of discussion.
Interesting. Thank you, Warren. We're going to look at number 15 now. What capabilities should be evaluated to qualify an individual to perform covered tasks? Lenny?
Okay, yeah, and it spells it all out right here, Chris. You need to, PHMSA wants to know that they have the knowledge and the skill and the ability to perform those covered tasks, and that they can recognize and react to task-specific abnormal operating conditions. So the knowledge portion, you know, it usually comes from computer-based training, on-the-job training, training center. You know, it could be even some individual training on their own, or anything along those lines, but there has to be some type of an assessment of that knowledge, which is usually the written exam or something along those lines. Now, as far as the skill and ability that comes to play normally in the performance evaluation, that individual needs to show that they have the skill to be able to perform that they know how to use the equipment, use it correctly, that they can perform the covered task correctly. And that is a huge word, correctly. That is a big part of this. On the ability part of that, again, this is something that in an evaluation of an individual, you need to make certain that that person has the ability, both mental and physical ability, to be able to perform that covered task. And that's part of the requalification process, right? That's the way we always looked at it. One of the reasons for requalification is somebody may lose that ability, you know, whether it's mental or physical. So that's part of the requalification process. So you got to keep that in mind. You're not just looking at their physical ability to be able to do that, but the mental. So if they've had an accident or an illness that's taken away that ability in any way, they should not be qualified, or at least be reevaluated to see if they should be qualified. And then again, they need to be able to show that they know how to react, okay, to recognize and react to abnormal operating conditions that are specific for that task, okay. And again, we've got general abnormal operating conditions as well. But for right here, we're talking about this task-specific AOCs, Chris.
Thank you. And yeah, it's so much more defined than before, it seems. Number 17, if an individual seeking qualification to perform a covered task fails the evaluation process, how many times can that individual be reevaluated? Warren?
Well, the regulation didn't have any direction about this. You know, the operators got to determine and specify in the program how many times that they're going to allow an individual to be evaluated, be reevaluated. And I know they may be conditional versus a new employee versus an existing employee, but an operator's just got to state it in their program and then follow it. There's times that I know there's operators that a lot of operators have established 3 times as a cutoff. So you take it the first time, you fail it. If you take it a second time and you fail it, they talk about providing additional training. And then the third time, again, it's, and this has always been personal to me, is how much, how many times does a person, eventually they're going to figure out the test and they're going to score and pass it, but then you're going to send this person out to do the work, and they may have stretched their knowledge or they may have stretched their ability to get there, and you're going to send them out to work at night on a leak investigation. Are you really comfortable with that? That's always been personally me. One of the questions that I considered when I looked at these numbers. But an operator's got to make that call. From what this question is, that they've got to specify it in their program.
Thank you. Number 18 asks, what is a reasonable time between failure to pass an evaluation and reevaluation?
Again, regulation doesn't touch it. And so it's, again, all up to the operator to determine it. I've seen it where operators, especially like a written test, they will let them retake it immediately. One of the things, as I've dealt with OQ for so long, is talk to training people, and you worry about short-term memory versus, really knowing what you've got. So if you take a test immediately, you've already been told the answers. Going to be pretty easy to get those other 2 or 3 that you didn't know and get you going on to the next part of the evaluation. A lot of folks have, established next day or 8 hours as a policy. And this policy also emphasizes to the candidate about the need to be prepared for those evaluations. Some companies, have established that, and they found out all of a sudden their folks weren't taking it serious, and then they were short of qualified personnel. Another thing that they talk about in their answer says if fundamental knowledge, skill, or ability gaps are identified, that the operator should consider additional training. And we're going to talk about that here in just a minute. But if you've got systematic series of failures over multiple evaluations, then you've really got to go further and say, okay, are we really doing the correct training? Do we have evaluation or evaluation methods that are really going to test our people? And, are we in going in the right direction?
Thank you. Moving to number 19. Should operators implement measures to ensure that the procedures on which qualification is based are consistent with the operator's O&M procedures and the actual practices implemented in the field? And I love this answer because you can't put words here.
The short answer, yes. So, while some performance of a covered task are standard, locating lines or leak detection, some of the equipment and the brands of equipment are very dissimilar procedures. You have to calibrate different, and those are those areas where, depending on your procedures, again, this is going to go to training also. Do you have the correct procedures that go with the right equipment? If you've written your procedures, again, if you had tapping equipment, and there were 2 major companies at the time, and they had totally different procedures that needed to be addressed. That's the kind of thing we're talking about here.
Thank you. We're going to move to number 20. What credentials should a person have to be an evaluator? Lenny?
An evaluator needs to have knowledge of that specific task, right? They need to be like a subject matter expert. They really need to know the task. They need to be able to assess the individual, that they really know how to do each step of the task as they go through it, as they perform it. That they're not skipping steps, that they really know it. So the evaluator has to be able to assess that, which means they've got to be knowledgeable in that task. And there's different parts of that. Do they know the order of the steps? Does the evaluator really understand that? Do they know what equipment should be used, or what is the correct equipment? What is the settings on that equipment? Everything along those lines. You've got to be knowledgeable about that. So you can't just be a supervisor and think that you can evaluate your people. You've got to have that knowledge and that background. You know how it is in any type of testing or assessment. If you don't have knowledge in it, you really can't assess somebody correctly if you don't have that knowledge yourself. And a couple of other things along those lines. You may be really knowledgeable in this covered task, but it doesn't mean you are in every task. So again, you shouldn't be an evaluator for all tasks, only those that you have experience in and that you're knowledgeable about. The other part of that is the evaluation process should be objective, and it needs to be consistent across the board. Just want to point that out. That is the very last statement in this FAQ right here. And again, the evaluator, the main part is the evaluator really needs to know all of that. They also need to know what the AOCs are for that task, how to recognize them and how to react to them, so they know they're getting the correct responses from the candidate when they're evaluating them.
I'm sure it's also a safety thing. Like if you don't know what could happen, like how could you step in and prevent, right?
Right, and the evaluator needs to stay up to date on that knowledge, because again, equipment could change, your own standard operating procedures could change, anything along those lines. You need to be knowledgeable in all of that.
Thank you. Moving to number 36, must records be maintained on the methods used to identify which tasks are covered tasks?
Chris, this is actually a kind of a change in enforcement for FAQs. In the past, if an operator had to have records on how they identified their covered task. They, a lot of notice amendments were written to say, how did you actually do this? And now operators are not required to demonstrate how each of its covered tasks were identified. Again, at this time, we're out 20 years since the regulation and folks had to be qualified. Most people have a covered task list. There's standards out there that are covered task lists. Now, new ones going forward, I think, it states in there you want to have a process in place to identify new ones, but you're not going to have to have the records. And that's quite a change from past policy.
Man, if I'm reading it right, and if I heard you right, it still requires them to include the provisions of how they identify covered tasks, just not each one anymore. Is that correct?
They need to have provisions in place to do it, but they don't have to show records. Yeah.
Thank you.
You bet.
Number 37, must records be maintained that show how the operator determined the intervals at which an individual performing a covered task will need to be reevaluated? Warren?
Again, this is another change of enforcement for FAQs. Although it's not required by pipeline safety regulations, they're encouraged to maintain records to show how the operator determined the intervals, I'm sorry. But as a note, I want to make sure you know that if you decide to lengthen your reevaluation intervals, which, there are folks kind of looking at these now because they've got 20 years of data that they make and say, hey, we can take this from 1 year to 3 year, or 3 year to 5 year. One, if you make that change, you would have to notify PHMSA or the state, and you may be asked for your justification. So although the records aren't going to be required, you may have to justify it somehow, how you made those changes. So it's kind of a, push me, pull you type situation.
Note, and you noted the word encouraged on there too.
Encourage, you bet.
Number 24, can new employees work under the guidance of other qualified crew members for a period of time? If so, how long? So span of control.
Span of control, and it says can new employees, and it could be new employee or it could be somebody that's not qualified. I took that as both. Mm-hmm. If they're directed and observed by a qualified individual for the task that they're performing, the work can go on indefinitely because there's nothing in the regulation. The regulation is silent. The guidance that they have provided suggests that the operators establish limitations. And that's just about as far as I think they'll take that.
Thank you for that. We're going to move on to the topic of training, or questions related to training. And we're going to start off with number 7. How should training be incorporated in an operator's program? Warren, you want to take this?
I do. The appropriate training is required to ensure individuals performing covered tasks have the knowledge and skills needed to perform the task. It says required. Again, it's kind of like must. I just want to take you back just a little bit. It's been 28 years since training was introduced as an NPRM to industry back in 1994. And that was as a response to NTSB recommendations for some incidents that occurred on the Kansas-Missouri border. When that went out, it was just to have people trained before they do the work. And industry said no. NTSB never accepted training as appropriate, the language that was put in 2006 to address those original recommendations. So now they've got the language in here making it's got should, but again, required up and top. So you're going to have to do some training. Here's what it should be: incorporated in practices leading to the development and qualification of new employees, as well as practices that refresh the knowledge and skills of individual with experience. The operator shall, again, there's another big word, determine the appropriate training methods for these circumstances. In particular, any significant change in the procedures performing the covered task should be subject of training for all individuals performing those covered tasks. So you've got required, you've got shall, and you've got some shoulds in here. Another big area that I believe that, as an operator, you should be reviewing and deciding what you're going to have to do. It also goes on to say it's the operator's responsibility to provide training to ensure individuals have the skills and knowledge necessary to perform covered tasks on the operator's unique pipeline system. This is going to include your contractors. This is one of those things, is how are you going to get training to your contractors? Operators must retain these appropriate training records to support individual qualifications and requalifications. Can't emphasize how important this one question is for you.
Yeah, it's and if you don't document it, it didn't happen, as we've said before. So that's something to definitely be looking at. We're moved to number 8. What is the role of computer-based or web-based training in complying with the OQ rule?
The use of computer-based, web-based, or any kind of training is strictly up to the operator. It's just a type of training. The training that's going to be provided, again, must address procedures, characteristics, and equipment. And they did make this statement in this answer, is that inspectors do have the authority to review the training during inspection. So you're going to have training, and the inspectors have the authority to review it. So it's not just, a true false, 2-question true false training test. You're going to want to make sure that you've got integrity in that test, and something that's, going to actually provide something valuable to your employees and the contractors.
Thank you. Here's another one, number 29, and the last one we're going to highlight today. Do qualified individuals need to recognize and react to abnormal operating conditions? Lenny, you want to take this one?
Yeah, to everyone that's been listening today, the answer is yes. One thing I noticed with the FAQs is many times AOCs are listed in the FAQ answers. I didn't get a count of them, but it's in there several different times, both being able to recognize and react. So And the operator needs to make the determination on those AOCs, okay, for that specific task. But the individual is expected to show that they know how to recognize and react to all of those task-specific AOCs. Now, some of these tasks, and you've seen this, Chris, where they may have 20, 30 AOCs listed for them, plus whatever else the individual may have seen or experienced themselves that they've seen as far as equipment or procedures that they know could be a possible AOC. But they need to be able to show that they can recognize that and be able to react to it. Again, it is a huge safety part of it, but it's definitely a large part of the evaluation and knowing that the person is qualified. But again, like I said, some of these have 20, 30 of these. The individual, and I like the way they listed that here, is not expected to recite the complete list. Okay, but the operator needs to decide how many they want listed. If they've got a minimum amount of 3 or 5, whatever that is, and they need to make sure that their contractors know what they're expecting along those lines also. But they're not required to recite all of them, but you probably should have some type of a minimum number that you require that they give you during the evaluation.
Thank you for that guidance. We've reviewed today and highlighted over half of the items that are listed on the new FAQ. So there's much more to look at. We now would like to give you, our audience, an opportunity to submit any questions via the question and answer feature or chat here in Zoom. Warren and Lenny and our moderating team will take those and answer those. What you enter there will be only visible to our moderators, and so it's all anonymous to the other viewers on the screen on the webinar. If we don't get to your question, we'll be sure to follow up with you individually. But before we get to that, we'd like to do a little recap of the top 5 takeaways from today. Warren, can you go over that for us?
You bet. Number one always is operator's responsibility. This has always been the case. To ensure anyone performing covered task on their facilities, they're qualified to perform those tasks or under the direction and observation of a qualified individual. It never left you. Second one, qualification of certain emergency responders. Again, this is a huge issue that is now in writing, and many operators will have to determine a course of action regarding this requirement. Written plan needs specifics. If your plan has not addressed a number of the areas we discussed today, you may need to amend your written plan. And then I really want you to be observant if those changes you make to your plan could be considered and you need to take further actions. Procedures must be provided. Again, operator procedures or company approved contractor procedures must be in place prior to the work being performed on your facility. And then probably the biggest one that's going to be with you is training is required for everyone performing covered tasks. Some of this language comes out of the OQ NPRM that was not acted on, specifying training for new employees and existing employees in different areas of process, such as disqualifications, new procedures, new covered tasks, requalifications, will require some operators to make some major changes to their program.
Thank you, Warren. It's now time for us to answer your questions. So again, you can get those in via the Zoom question and answer feature. And Kayla, our marketing officer, will ask them to us, or to Warren and Lenny. Kayla, what's our first question?
Sure. Thank you, Chris. We've got a lot of questions that have popped through the Q&A box in the chat. So I don't believe we'll be able to cover them all this afternoon or this morning, but we will follow up with you guys after today's discussion. So the first question I have is regarding the frequency of performing covered tasks. You stated how often a qualified individual performs a covered task should be considered during the evaluation of someone being qualified. I'm unaware of anywhere in the regulation frequency of performance is required to be tracked or documented. Am I missing something? Warren, I don't know if you want to take that one.
How often? I didn't realize I said that. I think of the frequency. We were looking at the complexity and the consequence. There are some diff analysis that operators have used that they included the frequency, just because some companies may only hot tap one time a year, and some companies hot tap every single day. Certainly that should be considered. Most of the operators that don't have hot tapping crews, a lot of them decided, hey, since we're doing this once every 5 years, let's only qualify right prior to the job so we're fresh, rather than having done it 2 years and 8 months ago and have a chance of something going south. So
Thank you, Warren. Our next question is, we hold meetings with emergency responders. In that training, it is stated that they're not to touch pipeline facilities due to not being qualified to do so. Would this be adequate to cover an operator from having to OQ their emergency responders?
perfectly, because that, again, you've got in your memo, and you probably have your sign-on sheet, but if that's your liaison and you've said stay away, if they take action, it's disregarding what you guys have discussed. And so, yeah, I think you'd be safe and well protected.
Awesome. Thank you, Warren. Our next question is, regarding these changes, where should an operator start to determine impact to their OQ plan or operations? What are some good first steps?
Say that again.
That's okay. We do have a lot coming through. So the question is, regarding these changes, where should an operator start to determine impact to their OQ plan or operations? What are some good first steps?
Well, again, with this tool that we're going to send you with the Excel spreadsheet, really would like you guys to go in there and look at it, in comparison to what your current program is, and see where the highest impact is, where you can affect change the quickest. And that would probably be the fastest, as far as at least figuring out, what you need to do, and then try to figure out a timeline on how to do it. And get back with me if you have questions, I guess. That would be easy.
Thank you, Warren. We'll cover one more question and then we'll kind of wrap up for the day. Is it possible for an off-the-shelf OQ program to satisfy the regulations without modifications or customizations?
I like to answer that one, because I'm going to tell you no. There is nobody out there that knows your program. And some of these questions have been very specific about, characteristics of your pipe, of your system, of your personnel. And as much as, if it's strictly off the shelf without any type of work or customization, I think you'd be hard pressed to call it good. And I don't think there'd be a lot of inspectors that would call it good, because they would be looking to see, how, there's just nuances in procedures and covered tasks that wouldn't cover possibly your procedures without, again, customization or specific training that you might put together. You could go that direction, but I don't know. I don't believe that's the direction you'd really want to go.
I'll tag on that as well. The ITS program, for instance, all throughout it requires the operators to supplement every piece of the training, the written and the performance, the OQ process in general, with their policies and procedures.
Yeah.
And ITS offers a number of ways to customize, and yeah, we expect you to really take a look at what you're doing. And So thank you. We have so many questions we haven't been able to get to. Obviously, this is a subject that, I mean, a range of subjects, but a lot of interpretation of change here. So we're going to wrap up now. Warren and Lenny, thank you so much for your time today and all the time you spent analyzing these FAQ updates. To your audience, thank you for being here with us. If you have questions or concerns about your own OQ plan and programs, we're here to help you. Warren and our ITS team offer a range of consulting services. And with all this expected focus on training, I just want to note ITS's learning management system Onboard is launching a brand new feature set, which puts creating training and OQ task lists into the hands of our client admin users. Our content management allows for you to create all types of training and testing content and upload them and manage them yourselves, from SCORM packages with interactive training or testing to video files to PDFs that can really help you get out the training that you need to your workforce and your contractors. Whether it's onboarding training for your contractors or an internal technical computer-based training or a roster attendance of a safety presentation that you did on site somewhere, it can all be delivered and tracked in Onboard and appear right beside your OQ records and on the ITS e-wallet card. We also offer instructional design services and psychometric analysis services. So if you don't have the staff time or the know-how, we're here to help again. So please let us know how we can be of service. You can reach out to info@itstraining.com. If you're a current client, you can get with your account manager to learn more. Kayla, I believe you're going to close us out.
Wait, can I ask one thing?
Yes, sir.
We did have a few people that sent in questions that we didn't get to that are under anonymous, and I'm just going to ask that if you send anonymous, I can't get back to you. So would you email me your question and I can get back to you? But there's 5 or 6 that I won't be able to answer since it's anonymous, the way it was sent to me. So
great call out, Warren.
All right, go ahead.
Thanks, Warren. So we do have our next webinar slated for May 25th this year, and we really want you to help us choose our next topic. So we're going to be sending out a survey in our follow-up communication, and we really look forward to seeing those results. Registration is now live for that May webinar, so you can scan this QR code on the screen or go to our website at its-training.com/regnav. And like Chris has shared earlier, we will be sharing various resources with you today in our follow-up communication. So what you can expect from us is a downloadable spreadsheet that lists the former FAQs and the newly published ones for you to do your own comparisons. The operator qualification history and milestones, a great resource to just look at and refer to. And then, of course, our survey for our next webinar topic. So we hope you continue to join us. We hope to see you in May in our next webinar. And again, thank you for joining us and stay safe.